Pretty simple. You can do that in anyone. If you're small, you can do it in anyone, no matter what size you are. It's easy to do. You can really control your arm. Think of it like one of those police shows where they're arresting some gouger and a chipper in England. Kind of like that, right? It's a little wrist lock type of move you end up in. If you work out where you're going to end up, then it's easy to work out where your hands should start. Okay? So that's your radial nerve. I'll get you this slide back in. You can do it in the text. I usually just flex the wrist up and stuff. You can't get much more on this flex. So, median nerve. Again, grip's going to be important on this one. So median nerve, you're going to grab around. My fingers are wrapping around his MT joints there, and his median nerve is going to go into his thumb, right? So if I let a lot of slack into his thumb, is that useful? No. So I want to have my thumb holding that back. So his hand is going to be flat like a tile, and my hand is going to go on there and hold it that way. I've got a decent enough bit of purchase there. And we go here. Now, there's nothing that's more disconcerting to a patient with carpal tunnel syndrome because you're looking at the wall. So make a bit of eye contact with them, start from you to it's better. See? We're going to start off with elbow or wrist extension. Sorry, yeah. You bring it into abduction, wrist extension, supination, shoulder external rotation, and this is usually the sensitizing movement. When do you start to feel the stretch is coming along? Nothing? Yeah. Side walk, dude. Side bend your head away from me. Nothing. Small little stretch. Okay, let your head back. Where was the stretch? Just got a little bit here. Nothing. Yeah, so you are actually a cyborg. You on morphine today? You don't normally find that's great. And actually what's great is I'm getting no resistance there whatsoever. Normally people will give you a little whoop, and no resistance whatsoever. It's great. Just relax, let it go. Perfect. We're going to compare one side to the other with these. And you've got to look at it when you're rating it. That's why it's important to be quite uniform about how you do it. It's the in-did idea. So in right there, let's say for example, in shoulder abduction and external rotation, wrist extension, I did elbow extension. And at about whatever degrees, he started to get sensitivity somewhere, wherever it is. Now what do we need to see is a positive neurodynamic test. What does it need to be? 3 things at least. Remember the slides? What kind of pain? Familiar pain. So it's the pain that we're looking for, that we're thinking we're trying to reproduce a little bit. So it's familiar pain. Then what is going to be different from? Left to right and different from normals. And then as you were saying that? Differentiation. Yeah, structural differentiation. If we do some kind of structural differentiation to change the load in the nervous system, does that change it? That make sense? With those 3 things. Because guess what? And we'll do it one last time. I won't do it again this year. Hold your hand up. Like so. Bring it right out. So shoulder abduction, external rotation. Do some wrist extension, supination, yeah. And stretch that out. Depress your shoulder. Head over the other way. So you all have carpal tunnel syndrome, right? So everyone feels something. I now can't feel my hand. It's not going to be useful for the rest of the day. So everyone feels something. In a slum test, everyone's going to feel something somewhere, or 90% of people are going to feel something somewhere. It doesn't make it a positive test. Do you know what I mean? Right. Perfect. And the last one, the ulnar nerve, and this can be a little bit tricky. So you can walk to me a little bit again, just yeah, that's perfect there. So you're going to have his elbow on your right hip. You're going to put your hands together like so, almost like it's the same person saying their prayers, kind of like that. And grip him with the thumb there, like that, to hold the hand. Because we've got to keep that little finger back now into extension. We can't let the little finger with flexion toe that way, yeah? So we're going to be in here. I'm going to start off grabbing your wrist. I'm going to go wrist extension, pronation, shoulder external rotation, elbow flexion, and then we have a little more abduction, nothing going on so. And we can either use flexion to increase the load, or we can use side bending that way to increase the load. It's kind of difficult to decrease the load on that. We can also use the shoulder. In any of these, you can use the shoulder depression to increase or decrease the sensitization. You with me? I will just explain then with a slide real quick what's going on. Come up here to do this. If we look at that picture there, what's going to happen when that person depresses their shoulder and the coracoid process starts to push